And thank you for joining this session. Our main speaker today is Professor Dr. Rukhsana Hussain Malik. And the program of the workshop is that first there would be interactive session by Professor Dr. Rukhsana Hussain Malik. After that, we will divide the participants into 5 groups, and each group would be requested to construct 2 BAQs, one from the basic sciences and other from clinical sciences. This might take about 20 to 30 minutes. And after that, there would be the presentation of questions and discussion on each question, followed by final question answer session before ending this workshop. You can ask questions live as well. If there is any issue you want to raise during the presentation, you can do that, or we can have questions towards the end as well. You can type the questions in the chat box as well. Right. With that, I will invite Professor Dr. Rukhsana Hussain Malik to make her presentation, and then we will follow the rest of the program. Thank you.
Assalamu alaikum, and very good morning and very good afternoon. Afternoon to the people in the east and good morning for the people in the west. Thank you very much for joining this workshop. Today we are going to talk about the best answer questions, their characteristics, their construction, and the complexities which are associated with them and how to overcome them. Before we proceed, just look at this one question over here. I put 4 pictures of the birds A, B, C, and D. The following birds are colorful, A, B, C, D. If it is a true-false question, the answer will be the A is true, the B is true, C is not very colorful, D is true. But if the same birds are asked, the bird with yellow feathers and long beak is, there will be a clash between the B and the D, and the people will think that probably the B is the one because it has more yellow feathers, while the D has less yellow feathers but a very long beak. So this is called as the single correct answer question because the true question in this will be the B option. While for single best answer question, which of the following birds is most colorful? So we are asking about the most colorful over here. And if you look at those four statements over there, A, B, C, and D, the first bird is apparently the most colorful over here. But all the other birds are falling in the same category, and they are, to some level, they are also very colorful. This is how we differentiate between the true-false question, single correct answer question, and the single best answer question. We'll proceed and we'll discuss in detail how this happens. After this session, the participants would be able to identify the learning outcomes, identify the learning outcomes that can be appropriately assessed by using BAQs, construct valid and reliable BAQs, keeping in view their basic characteristics and general rules, construct BAQ by using the classical format, which you can use your own university format as well, rectify or modify common flaws in written stems, lead-ins, and options to improve the standard of the BAQs. Before we go to the BAQs, let's have a bit of a history of the multiple choice items. Multiple choice is the form of assessment in which examinees are asked to select one or more choices from the list provided. There is a multiple true false format which requires the examiner to indicate all responses as true or false. We had type X, type K, type B, type C, and type E, which have their own characteristics and they have their own peculiarities. But most of these questions are not used currently, especially the type X. People have problems with that, and it has been considered redundant now. Although it was a very good form of question to assess the widespread knowledge which the students would have gained during the curriculum and has a wide range of options to ask the questions. But unfortunately, the questions constructed in that type of questions, type X, started to become more of a rote memory type questions. And the flaws in those questions are mainly because of the construction that led to its being considered redundant. So practically, I still believe that the type X questions are a good form of questions to assess the knowledge of the students. However, we need to construct them more carefully if we are going to use them. The other format is called as the one answer format, where all options are plausible and examinee has to indicate only the single correct or the best response. The type G is called as the single correct answer, SCA, or one of five, which it was called many years ago. The type A is called as the best answer question, BAQ, or the single best answer question, which is SBA, or one best answer, which is OPA, or the best of five, BO5. All these names are for the same type of question, which is the type A question, in which the students have to select one option only, which is the best among those. The type R is the extended matching type of question, in which there are a number of options and the student have to select only one option from those, reading the stem and then coming to that option. Okay. When we are selecting the questions, which questions we have to ask, generally we produce the blueprint. Blueprint is a sort of a data in which we are informed. We inform all the teachers, all the departments, that how many questions will be asked from which module and of which type. This type of tabulation helps in identifying the questions which will be appropriate for that type of examination. Also will ensure the equal distribution of questions between different subjects according to their contribution in that module, as well as the level of the questions can be maintained or can be monitored if we have a good blueprint of this. So practically, I have given you one example, which is the example of end of module and the preclinical professional examination question, which was for one of the papers used for the preclinical professional examination, that is the year one examination at the end of the year. It comprised of the CVS and the respiratory system module. Both of those modules were 5 weeks each. And the subjects which were taught were anatomy, physiology, biochemistry, pathology, the usual one, along with the community medicines and the clinical skills. The number of lectures which were taken by them, by these modules, by these disciplines were identified, were tabulated, and according to those, the questions which will be appearing from the different disciplines were calculated according to the input of those. Then we select of those number of questions. For example, for the PPEs, preclinical professional examination, there has to be 5 single best answer questions. So which modules, which disciplines will be getting those questions were calculated according to the number of the contributions which these modules are given for this paper. And for the end of module, the 2 questions were fixed, that if for that end of module, you have 2 BAQs, and there were, I think, 20 18 end of 18 true false type of questions which were used for these examination. So this is roughly a template which has been used, and the paper comprised of the CVS and the respiratory system, and the total number of questions then were 50, which were the true false type of questions, and 10 which were the single best answer questions for this paper. Similarly, we had 4 papers for all the different modules. Once the blueprint has been produced, then we come to the table of specification, in which we decide the questions will be derived from which lecture, which practical, which type of the teaching learning sessions, which are the part of the curriculum for that stage. For example, if you look at it over here from the physiology, these are the topics. There were 19 lecture topics which were there in the physiology module for CVS. The questions which were identified from there are listed in over here. That this because there were 5 BAQs. So one question will come from physiology, one will come from anatomy, one will come from biochemistry, one from the pathology. And because microbiology has a very little input, there will be no BAQ from microbiology, but there will be a BAQ from the pharmacology because it has number of lectures, 6 lectures, which were in that. Along with that, there were some interdisciplinary integrated sessions as well, IDS and the PBLs. Those were also included in some form of assessments in these papers. After the questions have been identified, this information is provided to the discipline coordinator, and the discipline coordinator or head of the department will then distribute those questions to the respective lecturers who have conducted those sessions to prepare those questions. After the questions have been prepared, the discipline level vetting will take place, in which those questions are vetted and modified and then revetted, or they will ask for the new questions according to the set criteria. All accepted questions then will remain with the head of the department till the time comes to test the students. That will be either the end of the module examination or the professional examination. So these questions then will be presented to the faculty meeting, which is chaired by the medical education unit coordinator, and the members are all the concerned head of the department. The same vetting process will take place again at this level, and the questions which have been accepted, modified, changed, ultimately those questions are all checked by and signed by the head of the department, and they're submitted to the exam coordinator for formatting and the safekeeping, and they will be used for the examination. In our system, we used to have 2 sets of questions. One set is for the main examination, and the second set was used for the supplementary examination. However, the decision of which set will be selected for the main examination and which set will be selected by for the supplementary examination was not in the hands of the faculty. That was in the hands of the examination division, which was central for the university. So practically we didn't know that which paper will be selected for the professional examination and which will be selected for the supplementary examination. In this way, both the papers which were produced had to be of a good equal standard, so that there will be a fair chance of fair questions produced for both the sets. Before I proceed, I forgot to tell you that on the right hand side of your screen there is a column in which some further information has been given. This information is to increase your knowledge on the BAQ for further reading. This is not the part of this session, so I will not be talking about those things, but those who are preparing for their say certificate or the diploma examination for the medical education, they might be interested and they might find it interesting in some ways. Okay, what is the anatomy of the BAQ? The type A items have a stem, which is an introductory statement, usually within the clinical context.
Yes. Sorry to interrupt you, but in your slide of blueprint and then DTOS, you have used two terms, MCQs and single
BAQs.
answer questions. So you recommend to use a mixture of true, false, and mixture of one best.
Yes. We,
By
we, we,
MCQ,
we,
you
we
mean single true, false.
yes, true, false. We still use true, false questions. Yes.
Okay, okay. I think they are absolutely now obsolete.
No, that is what I was telling, that generally the consensus of the faculty members was that these questions are still good to assess the widespread, the the width of the knowledge of the students. So we still use them, but we have introduced BAQs later on. The number of BAQs now is gradually increasing.
Yeah,
Actually,
actually,
मोमेंट मत करो मोमेंट मत करो
जी 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 प्रोफेसर
अब मैं ये कहना चाह रहा हूँ कि हम उनको कम करते हैं
We are now decreasing the number of the true false MCQs and increasing the number of BAQs.
I think it is a time to tell the students that why there was a demise of these true false type of questions, because of the 50% guesswork. If
Yeah.
if if one student mark all the questions as true, he is likely to get at least 50% marks. So in Pakistan, previously we were using it, but now no university, neither postgraduate and graduate, they are using. Just my comments. Just
I appreciate your comment, Dr. Ahmed, but it depends upon the question construction as well. If we ask simple recall of the knowledge questions, yes, student will guess it and they will guess it correctly. Or if for the whole paper they will mark it as a true, then even then they will pass, or mark it as a false, even then they will pass. That is true. But if the questions are of higher standard and the questions are not 50% distributed like we normally tend to do it, then the if the students are smart, the teachers can also become more smarter than them. Thank you. Okay, so the anatomy of the BAQ is that it comprises of a stem, which is an introductory statement, usually within the clinical context. It can contain a vignetta or a diagram or a laboratory report or a radiograph or a picture which represents the problem of the patient. It is followed by lead in question. That is a very important component of the question. And it is always in the form of a question, which indicates the relationship between the stem and the options, which will be written below down. And it also is written as what is the most likely, most appropriate, most common, most specific, to focus the students on the thing that we are asking for only single best answer question over there. That is why the word most is used over there. Then this is followed by the alternatives or options or choices or foils, whichever terminology you are using, are 3 to 5, now extended up to the 7 replies, which are statement with variable degree of truth. The key is comparatively or absolutely best. It is very important to understand that the key might not be the best answer for that question, but the options which we have provided, among those options, it is the best. While the destructors are relatively less appropriate choices than the key, but they have an element of truth in them. For example, this is one examination. This is the template we use, which was used both for the end of module examination and the PCP examination. And in this, for example, we write this examination was conducted in which year, this question was used in which year, which discipline, what was the topic, what was the mode of the delivery, and who was the author of that questions. And we keep on adding in more information into it. Now, if you look at this question, that it is there is a stem over there which has a story over there, and according to that story, the student on duty suspected that there is an involvement of the two cranial nerves. So which one of the following is the most likely site of lesion in this patient. And then we have given 4 sites in the brain where this lesion can take place. What we are assessing over here in the student is that first they have to identify those 2 nerves which are involved. Then what is the origin and where these nerves are going to go? Where are their nucleus located? Whether the fibers of these nerves are going to cross from one side to another or not, and where these nerves are in close proximity to each other, where both of these nerves are simultaneously affected, which leads to this presentation. So practically, it requires a lot of thinking in this question, and that is why it has a high applied value over here. So the part over there is called as a stem. Then this is the lead-in, and then this is the options and the key answer. In the lead-in, when you see over there, we have also put which one of the following. This one was introduced because at that time the people were very much confused that there has to be only one absolutely or comparatively best answer over there. So this one was added just to focus the teacher on the questions, which was later on removed, and we didn't use one, which is not the part of the standard form. Okay. Now this is another question, which is clinical BAQ. Again, there is a clinical scenario. The clinical scenario takes the form of the history taking. What are the steps in the history taking and how the information is collected? And then which of the following is the most appropriate first choice of investigation in this patient? All these investigations are done in the condition which is mentioned in the question, but which one is the most appropriate first choice, or the first choice has to be identified. Again, stem, lead-in, and the key and the distractors. If we diagram these questions on the level of their correctness, from 0 to 100%, normally we don't allow the 0% correct answer, which is absolutely false. But sometimes when you want to test a very important content, but we don't have enough options, then we can use this once in a while. However, now there is a good debate that instead of having 4 or 5 options, which is the standard, we can use 3 options instead of bringing in the totally false option in the question. In order to rank order the relative correctness of the option, they must differ on a single dimensions, because we are putting them as which is the best from 0 to 100. So they have to be on the questions should be on that same dimension. Either they are all the relations, all the nerves, all the investigations, all the diagnosis, differential diagnosis, whatever we are checking on in this question, they should be all the same. While the second type of question, which is the single correct answer question, type G, which I have mentioned, all options differ on a single dimension again. However, only one is correct, while others are plausible, but they are false. So the student knows that this is the only correct option, while the others are plausible. For those students who have not read the topic clearly and nicely, for them it is false, but for all the others, this is the best. Only one is the best answer. One is the correct answer. Okay. On the marking sheet, the questions will be A, B, C, D, on E, and they have to circle that the circle. They have to fill that circle with the A2 pencil, B2 pencil, because that pencil is read better by the optical reader which is used. Or there are rectangles which is used usually in the European countries because they are more wider and bigger in size, and they are better read by the optical readers. Another thing for the question is that you have to do the item analysis of all these type of questions, and you have to identify the difficulty and discrimination index, how difficulty and the distractor effectiveness, how good were the distractors. Technically speaking, at least 5% of the students should select one of the distractors. For example, the A distractor should be selected by at least 5% of students. B should be selected by at least 5% students. Similarly, C and the D. If they are not selected by the 5% of the students, so that means that this distractor is not effective and it has to be changed with another distractor for the next examination if we are going to repeat this question. So for the validation of the BAQs, we have already mentioned this. Okay, so if we compare between the type A and the type G, the stem in the type A is always there, but for the type G, it may or may not be there. The lead-in is always there for the type A, for type G, it may or may not be there. Lead-in statement is always as question. I'm repeating this because sometimes we just write a statement over there and make it a best answer question. It is not. The number of options are 3 to 7 for type A and 4 to 5 generally is the standard for the G type. Character of the options are always homogeneous for the type A, but for the type G, they are usually homogeneous. Key selection is the best in the list, and for the type G, only correct in the list. It's not the best, but it is the only correct. Distractors are all plausible and correct to various extent. For the type G are all false but plausible for weak students. While the cover test is not always reliable for the type A and for the type Gs, it is always reliable. Why not always reliable? Because as I've told you, the best answer provided which in the list of the options may not be the best answer for that situation. And that has been missed and that has not been put in the list. So practically it is normally for the cover test, we say that if we cover the option, the student will automatically come to the answer. This is not true for the best answer question. This will help to review the items to ensure the clarity and get feedback to confirm that the question is easily understandable. Now the characteristics of the BAQ. Focus on specific learning outcomes of the topic identified in test specification like common conditions, important life-threatening situations, etc. Example is one biochemistry question over here in which a patient is brought to the AN department with myocardial infarction. Blood investigation for cardiac enzyme was done. So question is that elevation of which of the following enzymes is most specific for confirmation of myocardial infarction? Practically all of them will arise, but the creatinine kinase option C is the best in this question. The STEM should have a good match between the cognitive level posed by the question and the intended learning outcomes. For the question should be from the HOTS more than from the LOTS. If everybody's familiar with the Bloom's taxonomy and the questions from the lower two part, that is the understanding and the recall of knowledge, they are called as the LOTS, while the HOT questions are which go at the high level of analysis and synthesis. Okay. Again, there is one question. This is from pediatrics. It has a scenario which is followed by the most appropriate treatment in this child. And you see that all the options are of the treatment: blood transfusion, factor VIII replacement, fresh frozen plasma, and platelet transfusion. So the student has to read the whole of the scenario, come to the diagnosis, then follow the treatment. In the treatment, the options are given, so the student has to select which option is the best. Okay, use novel material to test deep learning, avoid repetition to give wide coverage of curriculum, to get wide coverage of curriculum, and avoid testing only recall of familiar words, because this is not the function of the best answer question to let the student just regurgitate the things which they have memorized. In this question, Muhammad Akil Forges presents with chronic diarrhea. He looks small for his age. He has pallor. He also has abdominal distension and edema of ankle and legs. There is core peripheral temperature difference. Which of the following is the most likely diagnosis in this case? Again, these type of questions, according to the level of the students, diagnosis is made in the third year. In the final year, usually the students are asked more on the treatment type of questions. What are the investigation and what treatment should be done? So in the third year level, we go up to the history taking, the questions based on the history taking and also on the differential diagnosis. The characteristics again engages the STEM engages in a range of cognitive skills such as application, analysis, and evaluation beyond simple recognition. This is a physiology question from the reproductive module. The history of the patient is given, but then again, the question is based, the lead is based on the physiological causes for our symptoms, which is mainly on the physiology part of the condition. The STEM should reflect real life problem solving, like the things are done in the clinics or in the PBL sessions in which they have been studying the different case scenarios. Use authentic clinical context and seek permission of, if you are utilizing the case history of some patient from the ward, then we have to seek the permission of the patient. Microbiology question is over there. Which shows the symptoms of the condition, the general physical examination, and then the question is mostly on the most likely infectious condition which is suspected in this patient according to the information which is provided in the scenario. This is a leptospirosis is quite common in this side of the part of the world, and usually the patient will present with leptospirosis. So the question is quite valid for people living in this area. Okay. Item should assess the latest method, investigation, and protocol. For example, this question is from genetics, and we are asking the throughput method of identifying drug targeted genes into it. So a lot of genetics is taught into the students in the year 1 and year 2. And the PCR and all those methods are commonly used. So practically the question is on this. The practice should be evidence-based medicine. We should avoid the opinion-based item. Now, if you look at this question, there are 4 options given over here: E. coli, Haemophilus influenzae, Neisseria meningitis, and the Streptococcus pneumoniae. We can change the scenario and change the answer of the questions in different examination, for example. And these questions are usually taken from the research articles by the microbiology people, for example. An outbreak of meningitis in a military camp, bacterial investigation shows a capsulated bacteria. Which bacteria is most likely in the military camp? Usually the cause is the Neisseria, the meningococcal meningitis. And if you just simply change the scenario over here, a neonate developed acute pyogenic meningitis 1 week after birth. CSF culture showed again the growth of a bacterial pathogen, which is the most likely bacteria of meningitis in this neonate. The answer will not be Neisseria meningitis, it will be E. coli. So what I'm trying to say is that you can prepare a template and then you can keep on changing a little bit in those templates and keep on rotating your model answer in that one, especially for those in which you are having, for example, the nerve injuries or in anatomy, or you have a list of enzyme in case of biochemistry, or you can in microbiology, you are asking the question from different type of the microorganisms. Avoid over-specific and over-general content. Both are difficult for the students to find the correct answer for that. The 24-year-old man who survived a bullet wound to the head lost his ability to recognize his friend and family. However, he was able to recognize and identify them through their sensory modalities such as auditory, tactile, and visual. Very high level question: which of the following is the most likely site of lesion? The site of lesions have been changing over the years because it is a research topic. Previously it was parahippocampal gyrus when I used this question for the first time about 5-6 years ago. Then nowadays the latest research says that it is the fusiform gyrus which is most responsible for it. So this type of questions practically, which are of very, very high level of research level, should be used with a lot of care for the students which are in year 1 and year 2. So avoid content which is under research. which is not included in the curriculum or not at the level of the students. The characteristics of the lead-in, they should be clear, unambiguous, and focused formulation of question. A question is preferable to the open-ended phrase, focuses on a single dimension, and all options are homogeneous. Again, in an anatomy question, there is a scenario of a patient being diagnosed with squamous cell carcinoma in the histopathology of the done. The carcinoma was in the middle of the lower lip. So practically this can be a pathology question if we change the lead-in and the options below down, but this question was on anatomy and it was focused on the most likely more lymph nodes which are involved in this tumor. And the students just have to know the lymphatic drainage from the lower lip in the middle point. So jugulohomide, all these lymph nodes are ultimately involved, but the most likely, the first one to be involved is the submental. So that becomes the best answer. Okay, the options require the application of knowledge to real-world situation, promoting practical thinking and deep learning. Again, a biopsy report of a 37-year-old woman confirms the advanced tactile carcinoma of the breast, which is the most characteristic histological feature which was asked. These all features are present, but which is the most characteristic is the D1, where I put one asterisk that these are the best answer questions. Okay. The construction, how to construct the best answer questions. The journal instructions are that for the item, the total reading time should not be more than half the time indicated for that item. The time given to the item varies from institute to institute. In some places it is 2 minutes, in some places it is 3 minutes, but there are some institutes which gives only 1.5 minutes, and there are some institutes which give even 5 minutes. So it depends upon that, but the reading time of the stems of the whole question should not be more than half the time indicated, because the student then have to think, to analyze, and to go to find the correct answer. So that needs also some working in the brain. The question should encourage application or interpretation of finding placed in clinical or pathological context. 30 to 120 words is the range of the words for a question, but longer stems can be used, but very, very rarely, very, very sparingly. Use man and woman, not male, female, gentleman or lady in the scenario. Use present tense, preferably avoid abbreviations except those which are widely understood, because the different institutes have their own form of using some abbreviations which is not accepted internationally. For the specific disciplines, clinical vignettes, radiographs, picture or photomicrographs can be used for applied anatomy, pathology, microbiology, and pharmacology. Laboratory reports for biochemistry, pathology, and microbiology. Again, research findings for genetics and community medicine, because they are more research-oriented disciplines. The gross or the microscopic features, again, for the anatomy, pathology, and microbiology. For the clinical, item should reflect the evidence-based, realistic clinical practice. In present tense, reading requires less than half of the item time. Again, you have to provide the patient data, which definitely should which should include the age and the gender of the patient. Occupation, when the scenario is such that the question becomes occupation specific as well. Similarly, some conditions are more prevalent in different races, so ethnicity can come over there, especially in Malaysia, because we have the three main communities over here, who are the Malays and the Chinese and the Indians, and some of them have some specific conditions which is more prevalent in one race or another, so ethnicity need to be mentioned in that. The presenting complaints, symptoms, and the duration, relevant past family and the social history, if required, you can have that in your question. The vital signs should be given, the temperature in degrees centigrade, pulse in beats per minute, blood pressure, mmHg, and the respiratory rates and breaths per minute. The idea of giving all that information is that the students in the early stage are learning how to take the history and how to register that history or write that history in the proper format. The physical findings, general physical examination, and the positive abnormal findings, but none of them should be interpreted for the students. Investigations and results, if required, again, if the question goes up to the level of the investigations and the result, it should be in a logical, standardized order. Normally, we try to take the same format of investigation as it is used in the hospital over there. The same sort of a template is produced. Because different hospitals, again, have a different way of writing those things. The STEM construction often involves complex scenario that requires careful consideration before choosing the most appropriate responses. Example, the ECG reports or the graphs or the values and the visuals. So they need a lot of thinking about it. For example, this question is again a very simple question on the orthopedics, but we have put up a picture over there to make it more clearer to the students. Which of the following muscle is most likely to be affected in this patient? This is for the year 1 question from the musculoskeletal module, and we have to select which muscle is producing this deformity. If the stem is long, the options are short, and beware of the reading time again. A 32-year-old woman visits GP for ongoing nausea and tenderness, tiredness. She's 6 weeks pregnant. She looks pale. The GP requests the complete blood picture, and following is the report. This is the complete report. You can reduce the content of the report by giving only the abnormal findings over there or the main findings over there, and saying the remaining report was normal or remaining profile was normal. Then it is, if there are not 5 options available, you can have 3 option statement as well, because if you're using 3, 4, or 5 and you have a template of the question, the answering sheet, which has 5 blocks over there, A, B, C, D, and E, then any number of questions can be answered in using the same format, and the same optical reader will give the correct information about that one. So we don't need to have a different answering template for the 4 option or the 5 option or the 3 option questions. It can be arranged. Okay, if the stem is short, the options could be long. Avoid definitions as options, because definitions are too difficult to construct in the same level and usually are too lengthy. Again, this is a question from a primary care. A woman whose husband was diagnosed was with Alzheimer's disease writes a letter of complaint to the consultant about the way she and her husband were told of the diagnosis, which is the most appropriate course of action in this situation. So therefore, options are given. Almost the same size. Doesn't mean that you have to count the number of words which are in that. It should take almost the same amount of the space in the question paper. Okay, provide only as much information as it is necessary. For example, in this question, in the biochemistry question, there is a good description of the problem has been given already, but then we are giving the information of the mutational analysis of the uroporphyrinogen synthetase confirms congenital. That is not required, because if it is not included in the statement, still the answer will be the same. So make sure that you are not giving too much of the information, because sometimes the student will confuse that why this information is given. And in that case, they might be giving the incorrect answer because of the confusion which is being created by us by giving them the extra information. So only as much information as it is necessary. It might be a bit longer, it might be a bit shorter, doesn't matter. Preferably, the lead-in should be positively framed. Negative lead-ins can be used if this serves some important educational purpose over there. Avoid double negatives, not uncommon, unlike, not uncommon, not unlikely, not unexpected, because these are expected, these are likely, these are common, so no need to add double negatives to confuse the student again over there. Again, there is a question over there, and they are asking the least serious type of spina bifida. This is one situation in which the least serious is important, because that will give the doctors and the patient some sort of a relief that the type of spina bifida which is detected is not a serious one. All options should be homogeneous, that is, all are tests, steps, diagnosis, mechanism of disease, treatments or relations, or alike, which are related to the scenario and are factual. Again, this is the question from the community medicine. A scenario is given in which the woman is having she has tested positive for HIV. She is pregnant and she refuses to take HIV testing. So, which of the following ethical principles will the physician be most concerned about in this situation? These are all ethical issues which are related to the question, and it's a good question formulation in which they are put. All options are worded clearly and concisely. Clear wording reduces student confusion and reduces the reading burden placed on the students. Avoid using tricky language that mislead or confuse the students. For example, this is a huge description giving of what the hypothesis means in research, which can be modified to a 2-line or less than 2-line of a statement over there. Usually these type of things are done during the vetting time, and we discuss those things a lot, and then we come up with a consensus that this small definition can help the student in getting the correct answer as well. Options. Make all destructors plausible with variable degree of accuracy based on common misconceptions or errors. Place the options in logical, alphabetical, or numerical order. It is very important so that the student having that notion that this examiner always writes B as a correct answer, or this examiner also always likes to put A as the best answer, because other options are produced later on. The correct one comes first. Should not be there, and the questions, the options are put in. For example, I normally prefer to put them in the alphabetical orders. All the destructors are similar in length, complexity, phrasing, and style to the correct answer to prevent unintentional wins. That I've already told one of the questions before. So this is a question from a pharmacology. Patient presents with asthma in the primary care center. It is very important that you tell them that the patient appears in which type of the medical facility, because if we are asking for the investigations of the treatment, it might change with the medical facility which has more facilities, which has more facilities available. For example, the tertiary, the main hospitals, then in the clinics or in the peripheries. Okay, best answer questions, the complexity of the questions. There were a number of studies which were conducted in 2000 and 2010s, which were on the flaws in the questions, which were identified in the medical journals, which were using this question as the CME, and for that CME, the teachers were awarded pass and fails, and they were awarded some benefits along with that. So this is one study which was done in 2006. It became a cult study, and after that, a number of more studies were followed. The purpose of study was to evaluate the MCQs utilized by the New England Journal of Medicine for CME purpose, which is a very prestigious journal of America. The methodology was one article is normally specified in that journal for CME in each issue. 2 OBAs from each issue were answered electronically. 20 consecutive issues of the journal were reviewed. All 40 AABs were reviewed using the taxonomy of the item writing principles. We know that there is a taxonomy in which the principles of item writing is given. which consists of 31 principles. Of those 31 principles, 20 principles were utilized. Each of the 40 items were reviewed independently. Similar rating was obtained in 98% of the items, and other two in which there was a disagreement that was resolved by consensus. However, the result shows that each OBA has at least 3 flaws with a mean of 5.1 and a range of 3 to 7, which is a huge number of flaws. Collectively, there were 203 flaws in 40 of those items. The similar type of study was then reproduced, say, in 2015 by the Journal Club Prevalence of, the topic was Journal Club Prevalence of Flawed MCQs in Continued Medical Education Activities of Major Radiology Journals. All 181 items of the January 2013 edition of AGR Radiology and Radiographics were evaluated by 3 reviewers for compliance of 7 MCQ writing guidelines only. 78 of the 181 questions, that is the 43% of the items contained at least 1 to 4 flaws, which makes the test 15% more difficult and increases the failure rate by 25%. That was all evaluated statistically. Conclusion was that a large fraction of radiology CME questions violate standard question writing principles, and some studies of the CME question in the German medical literature revealed flaws of in 65 to 68% of the items. That is more than the 50% of the items were flawed. Okay. So the flaws of these questions are identified under 2 main headings. One is called as the construct irrelevant variance. Construct irrelevance variance means addition or subtraction of the score due to the measurement of some construct or the trait which is not targeted by the test. The test is not asking those questions, but the question is constructed in such a way that it will give more marks to the student, or it will give less mark to the students. For example, it introduces unnecessary difficulty to the item affecting the student's performance. The effect of flaw on student performance is bimodal, making question either easier or more difficult to answer. And in that way, it will be poorly discriminating questions and benefits low achieving students and penalize the high achiever students. Exam vetting process should ensure the high standard of test items and sustain their content validity. Again, the second type is called as the test wiseness prompts, which the factor which differed across individuals. It is the characteristic not of the question, but of the individuals who are appearing for the examination that has influenced the test performance and contributed significantly to the test scores. As Dr. Amir was mentioning, the test wiseness of the students, the cues are more savvy to test wise and aids them in guessing the right answers. These flaws make it easier to answer the item correctly based on the test taking skills without necessarily knowing the content. It is seen in the BAQs, it is equally seen in the MCQs, a true false type. Test wiseness also could be taught to some students, which will increase their score after such training. There are a lot of tutorials which are available in the if you go to the Google search in the computer, which are going to tell you how to be more exam savvy. Well-constructed, high-quality items allows for the evaluation of the wide range of scientific content and the avoidance of technical requirements. In the CIV, we have window dressing, which is the excessive irrelevant information in the STEM. If you look at this STEM, the area which is marked red is all the description of the patient condition and the examination of the patient, which is done when we are giving the diagnosis at the end of the STEM. So if we remove all those red area over there and say a 72-year-old woman is suspected as a case of a chronic lymphocytic leukemia, the other part which is identified in red is redundant. Because what we are asking is the investigation of choice for subtyping of the chronic lymphocytic leukemia. Use no more words than are necessary to express meaning. Give enough relevant data. Avoiding unnecessary details is the way to go about. Vocabulary, use of vague, naughty words or terminology. Naughty words are which have too many knots, and the people have to disintegrate them to find out what this word means. The words which are in red, inaberrated, vulgarating, lost in steadiness and knock cover, ephemeral. These are the words which can easily be replaced by the normal English words also, which are, because this is not an English paper and we are not testing the English reading and writing capability of the students. So these, if we avoid this terminology, the question becomes much more easier for the students to understand. So the essence is to keep the vocabulary simple, clear, and appropriate for the student tested. Use familiar words. Question that touches upon more than one issue in a STEM, yet allows only one to answer, confuses the student over here. These are called as the double-barreled STEMs. A 30-year-old man, a known case of type 1 diabetes mellitus, presented with infected wound in his left leg, is found to have diabetic ketoacidosis. Okay, there are two things in this scenario. He has an infected leg, wound in the leg, and he has diabetic ketoacidosis. And the question is, which of the following is the most important step for the treatment of diabetic ketoacidosis in this patient? Infected wound, if you don't put over there, then you can simply ask the question on the treatment of diabetic ketoacidosis. Similarly, this question is on the injury. The person falls, fractures the humerus, but the question is both on the nerves and the blood vessels. The statement over there in the STEM is concerning the blood supply. There's some issues with the blood and some issues with the nerves. But the question is, which nerve is most likely to have been damaged with the associated fault is completely out of league with the blood part of the question. So no need to have those information which is not relevant for the okay, Maizatul, you want to ask
Yes.
any question? Yeah, please.
Yes, Prof. I'm so sorry to disturb you. For the question just now regarding the excessive irrelevant information in the STEM, that 72-year-old woman you mentioned regarding the rate statements that we can just omit. So in a BAQ, we can just like a 72-year-old woman is suspected as a case of chronic lymphocytic leukemia. And then the next leading, which of the following is the investigation of choice for subtyping of this condition? That's enough for a BAQ. That's good enough.
That's
Or
enough,
we need
because
to,
that question depends is for which year.
I see.
Because now it has become more like a pathology question.
Yes.
Yes. So
If
it has
it's
to
like
be in the preclinical years. Yes.
so if it's if I'm focusing in for year 2 pathology, so that is enough. It's good enough.
It's good enough because you're just asking your formulation of question is that you are only talking about the subtyping of
The disease per
the
se.
lesion. Yes.
Yeah.
Yes. Yeah.
All right. Thank you very much, Prof.
You are welcome. Okay. Negative leading, do not mimic the typical reasoning process which is normally done, because normally we don't ask for the negative things, we ask for the most common, most appropriate and things like those ones. So practically, if you put the least likely, it will be a bit confusing for the teachers and for the students too. Sometimes the student actually miss this word over there also, because when they see the most likely, and they would normally they're in the habit of having those words in their mind, and they might miss the least likely word over there. So the options are given over there, and you have to find the least likely diagnosis in this patient, which has no actually practical value as well, because Normally what we want the student to know is what is the most appropriate, most likely condition in that patient, so that you are able to treat that patient. But least likely is usually is not what is required in the practical life as well. Amir, yes, Amir. Amir,
Once again, sorry to disturb you, but I
no
think
problem.
being interactive is good. Students
Sure.
will be alive, they will not go to sleep.
Okay,
So,
thank you.
very interesting thing I want to tell.
Mhm.
In Pakistan, we are using a software, especially
Mhm.
for in the College of Physicians and Surgeons. We
Mhm.
have to enter our MCQs in a pool through an e-portal, and that
Mhm.
e-portal uses a software.
Mhm.
There are many things in that software, but one very interesting thing is that in lead-in, it doesn't accept these words. All these words which you have mentioned, like least, uncommon, not, accept, was
That is
exact.
good.
Yes.
That
So
is good. Yes.
I think you'll enjoy this very much information. Thank
Thank you very much. Thank you, Miss. So Pakistan is doing good job in that one. Huh?
you. Yes.
Thanks. Okay. Okay. Then there's the numeric data inconsistency, overlapping or absolute values. A patient undergoes a cystectomy for a dermoid cyst via laparotomy. Some spillage of the content occurs into the peritoneal cavity. The question is, what is the likely incidence of chemical peritonitis in this patient? This question actually I have taken from one of the books on the gynae book on the MCQs, and the options given is 5, 15, 25, and 45. Now, suppose the best answer is 15. It's an absolute term. What if it is 16%? What if it is 17%? So you don't give the absolute value. You always give the values in a range. Don't give absolute values. Always give in the range. And if you look on the right side of this presentation, there are overlapping values which are given. Less than 20 to 50, less than 50, more than 75. For example, B is 20 to 40, and if it is 20 to 40, less than 20 is also included. More than 75, then the 90% is also included. You get the point. So that means that you should not give those which are mutually exclusive or overlapping. Okay, long, tricky options. Don't use tricky or unnecessarily long, complicated options, and cooked options will confuse us. What are cooked options? When you're not getting the third or the fourth option with you, then you put in something over there which looks like it, which is not at all related to it. Again, this question was produced by Prof. Malik. So I'm giving this question, and he was telling me you're projecting all my bad questions over here. Okay, a 15 months old old boy is admitted with diarrhea and vomiting. His eyes were sunken. All the scenario is given. Then the lead-in is, which of the following who plan is most appropriate for rehydration of this patient? Plan A, Plan B, Plan C, Plan D. Okay. WHA has only 3 plans, A, B, and C, and there was no fourth plan available over there. So the D was put over there. This will confuse not the bad students. Bad students, not not those students who know the answer, but those students who are among the class screen, who know everything. It will confuse them. That probably they have missed some new investigation, some new plan which has emerged, and that is why it is coming. And that in that way they can be misleaded and they can give the answer correct. So practically it is bad for those good students who are more knowledgeable than those students who are weak in the subject, because weak students will know that there is nothing, they are not, but the intelligent students, the good hardworking students will look for a plan B somewhere. All the options are not homogeneous. So if you look in this question, all the options are A, B, C, and D are all different. So they are not on the same parameter. They are not testing the same thing. So you cannot find which one is the best in this question. So these types of questions are totally not allowed. Heterogeneous options are allowed only for a single correct answer question, and that is also very rarely. Options overlapping in meaning. Again, there is a clinical scenario followed by investigations, which is done immediately, and there is an arterial blood gas and there is a blood pH. These two are done together, so practically means the values will come together. So practically you are asking these two separately. So the student will be confused whether they should give the right arterial blood gas level as a true answer or the blood pH as the true answer. Keep the choices independent of each other. Okay. All and none of the above either be easily discarded or causes confusion. Wonder if options other than the one provided is correct. For example, in this one, the none of the above option was there. This type of question again are not the best answer question because none of the above is not the answer of any question. Which of the following is the most likely diagnosis? None of the above is not the answer. The correct answer is the focal segmental glomerulosclerosis. So all the options when we say the likely diagnosis, all the diagnosis should be put over there and not we use none of the above or all of the above options. The verbatim text flaw, the key answer is worded directly from differently from the destructor when they are picked directly from the book or an article. Because the questions are usually prepared from the articles, and in the articles, some wordings are used which are specific for those articles, while the other options are constructed by the teachers themselves. So the type of English which is used, the way the English has been used in the formation of the options become different, and the students are very good in picking them up. So in this option, you will see that A is three line answer, which gives a detail. So it is picked up from the book, while the other ones are produced by the lecturers. So A option, the good student will pick it up as the true answer. Many high-level ideas are not absolute, like never or always, and are eliminated by the test-wise students. This is the test-wise prompts in which absolute or vague terms is the issue. When the students are test-wise, they will not pick anything in which the are always, only, or never are used. So the option 3 is correct. So they, even if they don't know, they will tick on the option 3 and leave it to Allah that it will be the correct answer. Using woolly terms like usually, maybe, often, sometimes in option again will help the student in guessing the right answer. Should not be used. May have a low PSU2, sometimes have a low PSU2, usually or often are the bad choices of words. Words or phrases are repeated in the stem and options. The more repeating, the more likely it is a right answer. For example, this anatomy question, a patient with right parotid gland disease complains of pain in the auricle, external acoustic meatus, and the temporomandibular joint of the same side. Which of the following nerve is most likely to be involved? Auricular branch, auriculotemporal branch, great auricular branch, posterior auricular branch. Just say we would know that it is the auriculotemporal because it is mentioning the auricle and the temporal, which is the temporal mandible. So they will pick up by chance, by guessing, even if they don't know the answer. The convergence strategy is when the pair or triplet options which are given as a clue to the correct answers. Correct answers include the most element. I'll show you how this happens. There is a clinical scenario given. If the students, the good type of student, test-wise student, will not read the statement, neither they will read the lead in. What they will do is that this is the best answer question. They will identify the best answer by the exclusion method. Okay, the insulin is present in all of them. Sodium chloride in IV infusion, the percentage is different, so they will highlight which percentage, which are the things which are coming only one time, which are the things which are coming multiple times, and by the method of exclusion, they can find which is the correct answer. You get me? The subcutaneous heparin comes in 3 options. This option number A will be removed by the students because NaCl is 0.45%, while the D will be removed because it is the sodium bicarbonate intravenous. The 2 options which are left is in between these two, but over here the option is potassium. So subcutaneous heparin, IV insulin, and 0.9% sodium chloride infusion fits into all these three options is the most commonly used, so it will be the correct answer. Correct answer contains additional information to ensure that it is clearly the best choice, called the too long to be wrong rule. Again, there's a clinical scenario which is followed by the most appropriate next step in her care. What is done in the option B is that the rest request a culture and sensitivity test. It did not stop over there. It is giving the further information to rule out urinary tract infection. So the student will, the exam savvy student will pick this option in this case. Thank you very much. Should we open?
Thank you very much. Now yes, Dr. Amir has a question. Yes, please.
Thank you very much for a very nice and very detailed and excellent presentation, Dr. Sana. Well done. I have an additional comment on it. There is another very common mistakes which the authors make while making such MCQs, that they in the lead-in they don't refer to the, in the options rather, they don't refer to the scenario. They think that scenario is just an introduction. For example, they will give a very nice scenario and then they will ask a question which can be answered without reading the scenario. For example, in a case of infective hepatitis, they will give the patient value, they will give the laboratory reports, and the question lead-in will be, what is the location of ALT in liver? So,
that is true. That is true.
they think that, and especially the examiners of my generation, they think that scenario is just a tamid, an introduction and nothing else. Whereas every, as you said very nicely, every word in scenario, it counts now. There is no red herring, there is no extra.
Extra words. So you are going to be more say looking for the interest of the students. You should give only that much information which is required, and you should not include any extra word which is confusing for the student that why this information is given.
Yes.
Thank you, Dr. Amir.
Mama. Right. Thank you. Yes, Dr. Aisha Malik.
Assalamu alaikum. Assalamu alaikum. Can you hear me?
Wa alaikum assalam. Yes, I can, Aisha.
I wanted to ask something about the numeric data inconsistency part. Is it a good idea to give yani these kinds of percentages in yani in MCQ or BAQs, especially when especially because I belong to community medicine, so we know that the data keeps changing. So, yani, should we, because if we give these kinds of questions, then like asking percentage or the prevalence or, they change over time. So should yani, the students focus on this, and should we give these kinds of questions at all?
Some conditions which are research, for example, the question is from research point of view. Community medicine teaches a lot of research over here, and they provide data. In case of community medicine, they produce data, and a lot of questions are on the range of the range in percentages of those which are correct and which are available or which are not available or which are important or not important. It's given. But usually, for example, nowadays, what is the size of the heart? What is the weight of the heart? Nobody asks the students to memorize that. So it depends on which subject we are referring to and what is the aim of asking that question.
Thank you.
Thank you. Yes, Bushra?
Yes, ma'am. Thank you so much. This is very valuable workshop, and being an educator, we need to implement these kind of things for our quality examination. So thank you so much. All the information was very good, but from my side, I was disconnected when you was in the initial slides, and that was related to type of questioning, that is X, K, B, E, B, C, and E. So I had that information. Is it possible to repeat it here, or maybe you can provide some of the information or reading material related to types of these MCQs?
Okay, Bushra, this B, C are almost obsolete type of questions nowadays. As Amir was referring to, the multiple choice question type X is not used in many places. These questions are used not by the medical faculty, but by mostly used by the nursing students, by the pharmacy people, and by the what else is the dentistry department. They uses these type of questions. If you look at my presentation, you will find that information over there in that slide, which are these type of questions and what are their character over there. Yeah. But I don't think you should be wasting too much time because they're not used.
Be recording as well.
Okay, thank
Yeah,
you.
the recording will also be shared with you because I didn't dwell too much on that. You haven't missed anything from my side. Yeah. Okay. Thank you. Thank you, Bishra. Imtiaz.
Assalamualaikum, Prof. Thank you for the nice lecture, but I think it was a bit too fast for me. Trying to catch up, and attention, I think, was a bit diverted because I'm trying to.
Probably wrong time now. It's,
I was thinking there's on the slide there are some on the right hand side that I was trying to read at the same time, and I wasn't able to focus, so it was a
no,
bit.
that is why I stopped you. Don't do that.
Yeah. Okay, Prof. My question is a bit related to the way that we conduct exam. I'm working at the University of Mauritius, and
Okay.
we have a module system there where we insert a question and we put each answer. So it's recurrently got corrected, the question or corrected. So we choose from the system. So the system correct and give us the result. So I was thinking, is it because in the system, of course, you can choose true, false, you can choose a number of options and so on. So and we can, of course, reuse it, the question. But of course, I mean, the system also, is it a good way of using the system, or can it be further used? Like we're telling 5% of should be answering so that it is a correct distractor. So is it useful? I mean, for research, or better than using the way of paper, pen, and correcting that?
Definitely. Okay, what I gather from your comments is that you are using some mechanism in which the lecturers don't have to mark the papers. It is automated, huh?
Yeah.
And
Model.
that means that you are giving the key responses to that machine, and the machine automatically sorts out which
Yeah,
question.
we need to give
the-
the key answer to the,
Okay.
and also,
Okay. I mean that makes the work more easier for the lecturers. I hope it is foolproof and it does not make mistakes. Yeah. Uh, for the true false type of question in which only the true and the false is being assessed or marked, yes, we use OMR for that purpose. It's a good way of doing it because the human error is not there. You can analyze the data and find out from the difficulty and discrimination index of the question and the destructors. As a research paper, you can identify which questions were not good over there, and you can discard those questions, or you can modify those questions. It's a very good and very important way of recycling and reusing the question, because every time producing a new question is quite difficult for the lecturers as well. Have I answered the question?
Yeah, Prof. Yeah, answer. Thank you so much, because it takes a lot of time to do all the job and then put up the question, insert the question in the system, and then putting the correct answer. Make sure that it is foolproof, and also make sure that the correct answer when the student there's no wrongly placed or some highlighters which are left, or boldness in the characters that have shown that the answer. So it's a lot of hard work eventually have to put, but the machine correcting it, so it's make it a much relief to us that we get the result almost instantaneously when the student leaving the examination hall. We know the results. Yeah.
Imtiaz, the most important thing in this condition is that the onus of being very, very right and very, very thorough falls on the person who is preparing the master key for the OMR machine. Because sometimes a confusion occurs, and we experienced that in the final professional examination, that the medicine and the surgery paper key was not labeled correctly, and the key for the surgery went to the medicine paper, and for the medicine went to the surgery paper, and all the results were wrong, and so many people were failing in that examination, and then you redo it, and you find out that this is the problem. So it is very important that the correct keys are added over there.
Thank you, Prof.
Thank you.
थोड़ा सा मुझे ला के दे दो, मैं ये साथ सुन रही हूँ.
Bush.
Assalamu alaikum. This is actually the short form for Bushra. I'm attending it from Kashmir. I have a question regarding the leading statement. Is it okay to use terms like which of the following is most likely, or rather than having the absolute, is the which is more recommended, more likely, or something like that? These are the kind of questions that, for example, I'm an ophthalmologist. So if I'm asking regarding the diagnosis, which of the following is the most likely cause of the above symptoms? Is that recommended or not?
Most, we have to use that word. That is recommended. You cannot use more likely because there is a most over there. So you have to select the best answer. It has to be absolutely correct or near to the correct if you're not using the absolutely best answer over there. So the word most is to be used.
Okay. Thank you so much.
Thank you. Okay. Any more questions?
Right. Okay. So now we are going to the next step, which is that we will divide the participants into 5 groups, and then each group will construct 2 BAQs, one from basic sciences and the other from the clinical sciences. And I think you will have about 20 minutes to do that. And after 20 minutes, we will come back to the main stage and then discuss, present and discuss these questions. All right, welcome back.
Thank you, sir.
Right. I hope you had a good discussion and produced some good questions. Let's start with room 1. You know, any of the participants from room 1 can present. You can share project on the screen and we can discuss.
Hi. I'm still
Right.
doing my job. I'm going to be reading by 1 hour.
In room 1, we were 5-6 people, and we have jointly done the job.
Right, good.
Share the presentation with you.
Sure.
We have made 2 questions, one for clinical. The author of clinical is Dr. Wasim from Malaysia.
Right.
And there were other participants also, Dr. Usman Siddiqui, Dr. Imtiaz, and sorry, I forgot the name of the others. And this is the first question. A 28-year-old, it was for MBBS final year, and subject is internal medicine, area is CNS. Author is Dr. Wasim. CSF analysis. A 28-year-old man presented with fever and headache for 2 weeks. He had mild neck stiffness. Following is the report of CSF examination. Appearance turbid. Protein 2 gram per liter, which is high, and white blood cell count is 3000, which is also very high. Mainly lymphocyte gram stain negative, oligoclonal band negative, glucose low, and likely diagnosis. So he is tuberculous meningitis.
Right. Any comments from other participants?
The alphabetical order has not been followed in the options.
Okay.
Yes.
All right. So that's one. Yeah,
Actually, this is good strategy to do the alphabetic. The option should be in alphabetic order. And but very important thing is that if you have done the alphabetical order, we must tell the students that the options are alphabetic.
Yeah.
But in some institutes like our College of Physicians and Surgeons, which is postgraduate, they do very interesting thing. They change the order of the questions. For example, for candidate number 45, the question number 3 is not the same as
Yeah,
for the candidate number 40.
Yes, they shuffle it.
Yeah, that's
They shuffle it.
shuffling.
And
Okay,
they also
now-
shuffle
now-
the options.
Yeah.
They
Now
also shuffle the
my question, Dr. Amir, is: you think this is best answer question?
Yes, because there are many options and he has to select.
You see some of the options are absolutely wrong.
Yes, multiple sclerosis is not good.
You
Yes.
see here, if let's say the bacterial meningitis, of course, you would have low glucose, but you would have more lymphocyte, more neutrophils, right? In tuberculosis, yes, you would have lymphocytosis. Same in viral meningitis. But subarachnoid hemorrhage, for example.
Yeah, it is not a plausible.
Yeah. So
yes,
if
right.
we look at it, this I mean the question is good. Question is good, but
Yes.
there are some options which are
not plausible.
Yeah, absolutely. I mean the distractors are not good.
Yes, yes.
So
actually, a subject specialist has made it, so I can't.
Yeah, no. I mean, it is the information is not wrong. The conclusion is not wrong. But question is that the sum of the options are absolutely wrong.
It is not exactly homogeneous, and the last 2 options should have also been infective.
So I mean, that's the sort of positive feedback on that is that the scenario is good, the topic is good, it's appropriate for final year students, but the some of the options are are absolutely wrong. So
Yes, you're
that
right.
does not fulfill the requirement. What do the other people think about it?
Yes, sir, I agree.
I think
Is Dr.
I think
Wasim?
is
Dr. Wasim? Yes, any comments, please?
Yes.
Okay,
Yeah.
Sakina, Dr. Sakina wants to say something.
Yeah,
Yes,
okay,
again.
Dr. Skina, yes, please.
I think is the options single best in the single best answer. 4 options is better than 5 options nowadays.
Yeah, actually that's right, because when we want to make fifth option, it's really wrong, because very difficult to find options which are no fit into that. So that's why, like Dr. Ruxana was saying, that the studies are coming. Some people are even saying that the 3 options would give the similar result as 4 options, but we are following 4 options. So
Dr.
maybe,
Alam, it depends on the policy of the university, of the
yeah,
country, of
absolutely
the
right. Yeah,
in
absolutely right.
in Pakistan, we are still using 5 because the most important thing in MCQs is to reduce the guesswork. So if you reduce the number of options, the guesswork increases.
No, but
20%.
I think, Dr. Imtiaz, that may be valid if we are talking about true false.
Hmm.
So,
No,
but
in this also,
yeah, because
students,
if there is a guessing, there is no mark.
yes.
Yeah,
But
so the guessing is not giving any advantage to the student.
I mean, they just randomly they select it. Sometimes, if they
Yeah,
don't know
I
the
mean,
exact answer, they randomly select. And if
yeah,
in random selection, the guesswork can increase.
yeah. So what I am
Now,
saying is that the
now
guessing,
I'll give you the reference of the examination of USMLE and PLAB, which are
right,
the standard international examinations,
right,
and they are very much for the undergraduate. They are not postgraduate examinations.
right,
And our students have to appear in those. And
right,
Alhamdulillah, Pakistani students, they do very well in USMLE and in lab examinations. And
right.
they all use 5 options.
All right.
So,
Okay.
so
Anyway, I mean, as you said, that's the policy. Here
yes,
we are using 4 options, because
yes.
most of the time when we try 5th option, that is
Yes, you are right. This is
yeah,
this is
that's usually
this is
wrong.
a,
And
yes,
number 2 is that the guessing issue is not much problem in best answer question. That is a major problem in true false type.
yes.
Okay.
So our next question is
No, I think we'll go for one question each first, because the at the end we would have time. Then we would go for the second question for each room.
okay.
Okay, can we go to room 2, please? Room 2.
Sir, I was in the room too, but we had not decided which would be our final questioning. We had.
It's okay, madam. You can present, no problem.
So is my screen is visible?
Yeah. Yes. Yes.
Okay. So we have this questioning. One is. Sorry. We have 2 questions related to the cardiac one. So I'm reading this first one, cardiac, an ECG strip which is showing that the ventricular rate is 112 and the rhythm, the PR interval of this patient is 0.16 and QRS duration is 0.08 second. And one upright P wave before each QRS is showing on the ECG strip. So which of the following rhythm is this? So students need to interpret these options first.
So basically here we are simply interpreting the ECG findings.
ECG finding.
Right. So it's not related to any clinical scenario. Let's see what other people think about it.
So basically this is a strip of patient. So
Yeah, because I think there should be some clinical scenario, and then saying that these are the findings on ECG. What do other people think about it?
Yes, we understand it, but we were thinking that maybe the scenario became too long with this. If we put something else.
Actually, I think it's not a good strategy to give the findings of ECG. If you want to ask this very competency, it is better to place the ECG tracing on in the MCQ. And now there are facilities available where you can put on the ECG, and then as Professor Alam Chair has said, you give the some brief clinical scenario and give the ECG tracing. That would have been.
I think that's an excellent suggestion to give a scenario and then paste that ECG slip. And so we should not be interpreting data for the students. They should interpret themselves. Yes, Dr. Sakina.
I think this question, it is better when we add a photo of an ECE. At that time, it becomes better than with this quality of question.
Actually, that's what we were saying, that we need a bit of clinical scenario. And second is
Yes.
that it would be good if the strip is there and students read it and then
Yes.
interpret. Yeah. Any other comments, please?
think, Prof, it's also as close to the real life event. Nobody gives you, any description of this. They give you the CD tracing, and you have to handle that.
That's
in
right.
real life.
Yeah, I mean that's the more clinical and the real life situation, and would be more searching and more appropriate, right?
Yeah.
Yeah.
Just one comment. Actually, this is you are very right. Everybody is commenting. This is a technical term. This is called the recall. Actually, recall is not a good thing. R1 level, they are now proceeding for all 2 or 3 level minimum. In Pakistan, the CPSP or UHS, they are also demanding that the MCQ should be at the level of R2 or R3 minimum.
Yeah, if we follow the Bloom's taxonomy.
Yes.
If we follow the Bloom's taxonomy, yes, that's what is required. Yes, Dr. Ruxana want to say something.
In this question, the three options: the normal sinus rhythm, sinus tachycardia, and sinus bradycardia are assessing the same thing. You get the point? It's these are mutually exclusive. They become mutually exclusive. One is bradycardia, one is tachycardia, and one is normal.
Right. Can we go to room 3 for their question? Room 3, please.
Sir, Dr. Munazir is sharing her screen.
Thank you. Thank you, ma'am.
Okay, Assalamualaikum, sir. Sir, we made 2 questions. One was from basic sciences and the other one was from the clinical, as you told.
Right.
And sir, a 5-year-old boy presented to the OPD with the complaint of sudden onset redness, pain, and photophobia in right eye. According to the mother, he came back last evening from playground with these complaints. Which of the following will help you in arriving at the diagnosis? So history of photophobia, positive regurgitation test, positive fluorescein test, presence of spasm, and presence of meiosis. So
okay, what's the key?
So the key is positive fluorescent test.
Right. Comments from the participants, please.
May I know which other options are correct?
This is a scenario of keratitis. Without actually asking them for the diagnosis,
please.
we have made it so that they would only be able to arrive at the correct response if they know the diagnosis. The theme was red eye photophobia. The patient would have presence of blepharospasm. The other conditions that can cause red eye include acute anterior uveitis, in which case there would be presence of meiosis. And then another condition that can produce red eye is nasolacrimal duct obstruction, in which case regurgitation test would be positive. So potentially all of these can be correct, but in this particular case, because of the short history and pain, this goes towards and the history of coming from the playground where trauma is likely to happen. So in this particular case, the only absolute correct answer, the most correct answer would be positive fluorescein test, which would clinch the diagnosis of keratitis.
Right. Thank you.
Doctor, what is positive regurgitation test?
Positive regurgitation test is when you apply pressure on the nasolacrimal sac. If there is an obstruction of the nasolacrimal duct, the tears are regurgitated from the punctum. This leads to, if there is an obstruction, it leads to acute dacryocystitis, which again presents with red eye. But in that particular case, the history would not be this short.
बाकी टेक्निकल चीजें हैं बिल्कुल सही है डॉक्टर
Yeah,
ये पढ़ा था MCQ
no, the
very good
point,
MCQ
yeah, sorry. The point here is if you look at the options, they are not homogeneous. There are some tests, there is some science, and there is history. So if basically, if you want, the options should be able to grouped into one heading. For example, investigations or treatment. So because here the options are not homogeneous, we cannot group them under one. For example, if you want to say which of the following tests, so there should be all tests. Here, for example, first is history taking, second and third is test, fourth and fifth are signs. So either we should take all tests or all signs or all history points. So
right,
that, yeah, that because the options must be homogeneous. So that would be one comment about it. Any other comments by any of the participants?
Yes,
Yes, please.
Sakina.
Yes, Dr. Skina.
Yes, 5 years old boy. You should put an slash in between. 5 is 5 slash is slash old slash boy here.
No, it is not necessary, Dr. Skina.
Let's look at the content and the structure of the question. The other things, different people have different opinions.
No, Dr. Alam, let me say this is very
Yes,
important.
here in Sudan, the policy, it is mandatory to put it.
No, Dr. Skina, you're confusing one thing. There are two methods of writing it. Either you put dashes in it, then if you are putting dash in it, then you don't have to write years. Then it should be single. And if you do not put dashes, then you should write in years. So you can experiment it. If you write 5 years without dashes, the computer will automatically put a red underline in it. So there are both these options are okay.
Right.
Either years without dashes or dashes with only year.
Yeah, I think we should not be concentrating much on the language. Let's look at the really structure of the question. Yes,
This
Dr.
sentence,
Maizatul?
excuse me. Hello.
Yes, Dr. Maizatul. Yes, please.
Can I give my comments?
Yeah, let Dr. Maizatul say first, please.
Okay.
Okay, thank you very much, Prof. Alamshir. In terms of single best answer questions, I know that we're not concentrating on the the sentence or the English in the first place, but I'm just wondering because there's a lot of discussion in our organization regarding whether if it's a single like a 5 should be written as FIVE, not written as the word per se in terms of numbering. Is this a must or is just it seems just a formatting? And in SBH, it should be in present tense or it can be also past tense or it doesn't matter. Anyway, it's just formatting. Thank you very much, Prof.
Yeah, actually we are like Dr. Ruxana was saying, it's better to put it in the present tense, and any number below 10 we put it as number, and more than that is written in words, right? But
thank you very much.
That's sorry, this number 620385.
Yes, yes.
Yes, please.
Okay. I just wanted to ask this sentence. According to the mother, he came back last evening from playground with these. Is it important? I mean, is it giving some diagnostic information?
Yes, sir, it does tell you about the onset of the symptoms.
It's already mentioned
Yes.
because this is sudden onset.
No. The history of coming from the playground is hinting at trauma, which is the most likely cause of keratitis.
Okay, that's good.
All right. Okay, thank you very much. Thanks. Can we move on to room 4, please?
Aisha wanted to ask something.
Yes, sorry. Dr. Aisha, yes, please.
Assalamualaikum, sir. I thought, sir, I had lowered the hand. My internet is a little slow, so I thought because the point that you had raised, it was addressed that the options are not homogeneous. And the
Right.
clue to whether our options are homogeneous or not is in the lead-in. If we are having problem in putting the phrase after which of the following. So if we are not able to group them into one category, that gives us a clue that our options are not homogeneous.
Yes, absolutely right. Otherwise, you would say which of the following tests are which
Yeah,
of the
signs or
following
clinical tests or
signs
symptoms.
or
Yeah.
symptoms. Yes. Yeah, absolutely right. Yes. Okay, thank you very much. Can we move on to room 4, please?
All right, I'll share the screen for group 4, but maybe I would like to invite Dr. Mayo to present the anatomy question. Okay.
So our question is on the CVS.
Right.
So a 42-year-old male driver of a car involved in a MVA or motor vehicle accident had a blunt trauma to his sternum due to the impact of the steering wheel. So considering the nature of this injury, which part of the heart would be most likely to be injured? So we have 4 options. One is the anterior margin of left atrium, apex of left ventricle, right atrium, and right ventricle. So in this scenario, we are asking about the location, the site of which part of the heart or which chamber of the heart is likely to be injured. So, and for all the 4 options, they are all likely to be injured. All can be considered as correct. But out of these 4 options, the right ventricle is the most correct option because it was in the middle of the chest, that is behind the sternum. The others are at the front of the chest but some are on the left side, some on the right side. So the right option will be the right ventricle.
Thank you, sir. Yeah, any comments by the participants?
I think there are no homogeneous answer. I mean, the options are a bit, one is part of the left atrium, other one is a part of the left ventricle, whereas the other one is straightforward right atrium and right ventricles.
So for the left atrium, the anterior margin is important because if it is just mentioned as left atrium, it happened to be at the back of the chest. So it will be a false. But however, since it is a false option, you can still put it as left atrium, no problem.
Yeah, I think yes. Yes. Any other comments? I think that that was to me that was the right point. Just to say that all the options are of similar sort of length, and removing anterior margin would not affect the answer. Maybe only writing left atrium may be good enough. Yes, Dr. Mumtaz, please.
Thank you very much. Just comment and also want to ask few things. For me, this is actually it's the same similar to the recall level. This scenario is telling about these things, although these four odds may be right for people who are not cardiac surgeon or cardiology. But don't you think that it's a similar to recall? We should have some STEM like where student have to think over it, and then he has to conclude something, and then he choose the option from these four scenarios, something like this. It shouldn't be like something. It's just for me, I'm just thinking that if anybody has blunt trauma, and most probably he has out of these four, he has the only of a structure that is damaged. What do you think? It shouldn't STEM shouldn't be like this, that student have to think over it and have to evolve something from the given data.
All right. Okay, so there's a comment by Dr. Mumtaz whether this question is really searching the information or it is straight recall. Let's say Dr. Amir, please.
I don't agree with Dr. Mumtaz. I think in anatomy, so it's not a question of cardiac surgery or something. It is anatomy, and I think it is very difficult to make scenario-based questions in basic sciences, and the attempt is very good. And also, yes, you are right that some recall is involved, but if you put some other thing some other information in it, then it will become very, very difficult for the student of first year or second year of MBBS. This is my opinion. Second, two small observations in this scenario. One, as we have decided that we should not use the word male and female, rather man and woman, because of the modern trends. And the second is, if while you have explained the abbreviation motor vehicle accident, then no need of writing the abbreviation. Only you should write the abbreviation only if you have to repeat it in the scenario. When you are not repeating it, then I don't think you need to write the abbreviation.
Right.
Thank you.
Thank you, Dr. Amir. Yes, Dr. Aisha.
So just wanted to add to what they've already said. I think it's nicely done. It depends on which level of students are addressed at. If it's for first year, second year, especially for first year, then it's nicely done. The structures are in the same plane, which they have mentioned all the options. So the only thing is that when the heart is injured, and especially if it's first year, learning happens most at the assessment level. So the students may not think that if it's the right ventricle is affected and the rest of the heart can be okay. So in that case, the lead-in should have that which part of the heart would be injured the most. all of the heart would be affected, but which would be the part which would be injured the most?
All right. Okay. That's an interesting point. Yes. Dr. Amir, you want to say anything more? Right. I think we have a good
Sorry,
feedback.
no, nothing.
Yeah, we have a good feedback on this question, and I think we all realize that when we come to test the facts, like in anatomy, it's not easy to make these best answer questions. Most of the time, we end up with the single correct answer type, right? But I think we had a good discussion and good feedback on that. Thank you very much. Can we move on to room 5, please?
Yes, Assalamu alaikum.
Walaikum assalam.
Um, Dr. Imtiaz will be sharing the screen and I will be presenting. Actually, my name is Dr. Aisha. Actually, we were two in the beginning, just two of us. So we started it, and then right at the end, Dr. Sakina joined us. So we'll present the basics. One we made for the basic sciences because I belong to community medicine, and Dr. Imtiaz to
Yeah. Can you make it in a bigger please, the presentation form? Yeah. Right. That's good. Thank you. Yes.
Can you bring it down to the basic science question?
Okay.
Yeah, Dr. Imtiaz, make it bigger, but focus on the first question. Can I start?
Yes, please.
So the question was a researcher wants to conduct.
Yeah,
Can you go down?
Yes, now okay. Now okay. Yes, please. Yeah.
Researcher wants to conduct a research to see the effect of exercise on knee pain relief. He wants to enroll participants randomly into two groups, one who goes to the gym and the other does not, and follow them over a period of 6 months. Which study design will be most appropriate for this research?
Okay. Comments, please. Okay. Researcher wants to conduct a research to see the effect of exercise on knee pain relief. He wants to enroll participants randomly into two groups, one who goes to gym and the other does not, and follow them over a period of 6 months. Yes, comments, please.
Isn't it sorry, isn't it a one correct answer question?
Actually, yani, when we teach these, this is
The case control is a different type of a study. The cohort is a different type of study. Isn't it a one correct? All these are the type of studies which can be done for this scenario.
May I say something? I think the key is wrong. Key is wrong. I'm sorry, this is not my subject, but we all are into research. Cohort studies is that in which you follow the same patients for longer time. Okay, I think the options are quite homogenized. There is no problem in options. But if you want to write against case control, you can write prospective study rather than cohort. Cohort is a word which is used for any group of patients, any group of subjects, maybe in innate objects, anything which is that is called cohort. So a proper name of the study should have been mentioned here. Thank you.
No, actually, it's not like that. A cohort is the name of a study design, and it is when we follow people from the risk factor to the effect. So this is, yani, the key is correct. It's called the only thing, as Prof was saying, that yani, if we Yani, we included the word randomly to confuse yani regarding randomized control trial because it can become, especially because knee pain relief. So the student and going to the gym. So the students usually yani choose these things yani between basically cohort and randomized control trial.
Can I just add a few to the comments to the whatever has already been said? Structurally, this question is fine. There's no problem with that. But with regard to the theme that we are discussing, the public health or the research aspect of it, if since you have given a lot of data within the case, then it becomes only one best, just one correct. Then only one thing would apply. And here, the C and D are very close. Since you have already mentioned that there's randomization, and then the randomized control trial would also you can follow people up in randomized control trials as well. But if the data if the STEM had been structured in a way that all these can be plausible, so if you had not mentioned randomization into it, or you're just seeing the effect of exercise on it, then all of them would be likely.
I think if the word unblinded added in it, then it clearly rules out because there are three conditions for RCT. One is randomization, the other is blinding, third is the control. So the two things are fulfilled in it. There is no mention of the blinding. So if blinding is mentioned that it was an unblinded study, then it qualified for cohort. And once again, my comment is only writing cohort. The full name of the study should have been mentioned.
Okay.
No, that can be done.
Yeah, Dr.
Randomization.
Mumtaz, please.
Thank you very much. I was thinking that the STEM is good, but for me, I just want to ask, what is the distractor here? Actually, I think these four are totally different things, and one best answer is there. So for student, it would be easy to pick. Uh, Although this is not my subject, but I just want, is there any distractor also here out of these four options?
Yes. Right. Okay. Thank you very much. I think volume.
This is question from who made these MCQs.
Oh, sorry, I thought it.
Yeah. Yeah. Volume.
I think because I think as Prof. Roxana said, I think now when after discussion, I feel that yani, I think it's a
yes.
Sir, can I just clarify from the comment
Yes.
that was just given on that?
Yes. Yes, Dr. Aisha, you are muted.
Structured. A comparative cross study can give the two groups as well, so it would be applicable as there as well. But a cohort study is for an exposed and
Yeah, Dr. Aisha, you are muted.
The intervention is needed, since here it's the intervention exercise, the effect of which is being looked at. So the best option here would be D, randomized control trial, and not cohort. In cohort, the natural exposure dividing the two.
Yeah,
so all the options can be made plausible depending on how the STEM is structured.
Right. I think we are going into more technicalities, and not many of us may be the expert in this, but I think we had a good discussion and the feedback. Now, in the second round, can we start with the same group, the year 5, the room 5, and can you present your next question, please?
Dr. Kaz, you will
Please,
present or should I?
please unshare it. Please unshare. The group 5, unshare it. Stop sharing and then I can share.
No, now we are starting with room 5.
Room 5 was already done.
Yeah, no, their second question.
Okay.
So for second question, we are starting from room 5.
A 65-year-old man presents with facial deviation to right, and inability to close his left eye for the past 3 days. He was being followed for parotid gland tumor with the oncologist. There is no other neurological deficit noted. Which of the following cranial nerves is involved? And the options were facial, oculomotor, trigeminal, and abducent.
Okay. Comments, please.
Okay, can I comment?
Yes, please.
I think it is a single correct answer. It's not one best of 5 because this is the only choice. I don't think there is any other choice.
Right. Let's see what other people have to say. Any other comments?
Once again, I'll defend this question.
All right.
Although it is, I don't know the level. If it is for the undergraduate level, fourth or final year student of medicine of neurology, then it is good question because at that level, knowing about the facial nerve paralysis is good. It is good enough. So I think it depends on the level. If you say it is for the fellowship final year fellowship level, then yes, it is not good. But for undergraduate level, I think it is okay.
But okay, the question is all those 4 nerves. All those 4 nerves, they apply to the facial muscles.
If I may,
Yes, please.
the scenario could have been structured a little better if rather than saying the facial deviation to the right, if they had mentioned the loss of nasolabial fold or deviation of the angle of the mouth, because this gives a verbal clue, even if the student does not know that the facial nerve is involved, by giving the facial deviation to the right and then in the options having seen facial nerves. So it gives the clue that should not be there. So the stem could be structured a little better.
Okay, so that's the word facial, but the question was that do these all 4 nerves, do they supply the face? All of those?
The trigeminal nerve being the sensory supply of the face.
Right.
And ocular motor, because we put ocular motor because there's an involvement of an ability to close the left eye. So it is trying to think that those who are thinking about ocular motor or sixth nerve with the eyes,
Right.
an ability to close the eyes. This was the facial nerve being the only motor supply of the face.
Sorry, the abducent nerve?
Because of the eye, we put cranial 3 and 6 oculomotor and abducent because of the inability to close the eyes, the supply of the orbicularis oculi,
Right.
just to distract them from the third nerve being the one which supply all the extraocular muscle of the ocular muscle of the eyes, except the fourth and the sixth. So we put the sixth nerve as a distractor here.
Right. Okay.
But actually, while doing the thing, we got a bit entangled in that, Prof. To say we wanted at one point of time to put the right or left facial nerve, and then wanted to think maybe we put upper motor and lower motor, and that we become a bit more difficult. So it was entangled in that, and we had to make it as simple as this one.
Right. Let's see. We have comments by Dr. Rukhsana.
The option number 3, trigeminal nerves, gives the sensory sensation. There is no motor input over there on the face. The abducent nerve is not at all involved in the face. It supplies the muscle of the eye, and that deformity which is produced by the abducent nerve is not mentioned over there. So practically in this question, you can say that the facial nerve is definitely involved, and the oculomotor nerve is also definitely involved. So there are 2 questions which are definitely involved. So the students will be lost over here that which one they are going to put right, because this is a single the single best answer question, and they can give only one right answer.
Okay, I think oculomotor is not
So
a
the A
possibility.
and the B are definitely correct. Both of them are equally correct. So both of them should be over there in the answer. But while the trigeminal nerve and the abducens nerve is not involved at all.
Why do you say that the oculomotor is definitely involved? Oculomotor is involved in opening of the eye and not in closing.
Inability to close. Okay. So sorry, I didn't read that in. Yeah. So the facial nerve is the only correct answer in that case.
Yes, so this would be
A single
the
correct
one
answer.
correct answer. Yes, not the
Yes.
best correct.
Yes. Thank you.
Right. Azia, we have been, we have been discussing this because if we are going to make these best answer questions in anatomy, it's really difficult. Okay, can we go to room
Sir,
4
one
for their
question,
second
please.
question?
One
Room
question
4 for
regarding
their
this.
second question.
The one question regarding this particular question only. If we were to make a question like this in the best correct answer, how should we go about it? Or is this modality simply not good for this kind of questions?
Sorry, I missed part of your question, but what we are saying that the point where we are going to assess the straight facts, then probably single best answer is a single correct answer is better format than the best answer type. Especially anatomy would have not a problem if we say that we cannot have single correct answer, because they are most of the time in year 1, especially they would be testing the facts only. So I think we need to have this consideration that what discipline we are testing and whether that format is really appropriate for that discipline.
Thank you, sir.
Right, thanks. Can we go to room 4 for their second question, please? Yes, Dr. Aisha Malik, want to say something?
I want to ask, like in our college, we have the system-based, like second year, for example, have CVS, then they start with endo and like that. So they have questions from all the disciplines, like they're in the final end of block exam, for example, at the end of endocrine block. So
Right.
they have an. So in one exam, can we have, because if we can't, yani it's very difficult, as you said, very difficult to assess anatomy with the best answers. So in one exam, can we have different formats?
Yeah, let's see what people think about it. Let's say, can we have, the question is, can we have single correct answer type of questions and best answer type of questions combined in one paper? Any comments on that?
I think no, I'll say a big no, because that will totally confuse the students and the system also. We I think it is not impossible to make one best answer questions. One best answer question is ahead of time. It is a development. It is an evolution of questions. So when you are using MCQs only for your exam, then we must train our faculty and we must work on it and develop these questions rather than one correct question. Thank you.
Okay, that's one comment. In any other comments?
So to my mind, you can have a different type of format of questions, but it would be only possible if you have separate segments, because before the start of the segment, you have instructions for the students. For example, choose the best response or choose the correct response. So if you have section A, choose the best response, and section B as choose the correct response. So yes, it is possible to have two type of questions in the same paper.
Right. So, okay, so that's one solution. Okay, any other comments? Let's say if we have lead-in statement for every question, does that help?
So too much time consumption. lead-in statement to be read with 50 questions every time.
Yeah, but because the lead-in statement would be different from different question. One is okay. Sorry, I'm thinking of clinical side. You are thinking of basic science. Because if we think of clinical side, then every lead-in statement is different. One may be about investigations, one may be about treatment, etc. So I don't know whether we the now the point is that should we have lead-in statement for every question, irrespective whether it is basic sciences or clinical sciences? I think lead-in statement may be different for different questions. Any comments on that, please?
In the
Absolutely.
questions would have their own lead-ins, even if it for basic sciences. If you're asking for a nerve or a vessel or a structure, it would definitely have its own lead-in.
Right. So this means that, and that was my question, that if we have lead-in for every question, then does it matter whether it is a single best answer or a single correct answer?
I think it doesn't make much difference.
Yeah, because if we have the lead-in statement for every question. Yeah, Dr. Mamtaz, please.
Thank you very much, sir. I think you are very right that all depends on the lead-in. Both are okay, but just my feeling is that people are moving from the all correct answers to the single best options. So
Right.
all depends on your STEM and lead-in. So what you ask there, and but preferences goes to the single best options.
Right.
Maybe all four or five options they are correct, but what fits in this scenario, actually we are asking that thing. So from this statement or this term, there would be only one option that exactly fit in that scenario.
Right.
So,
So this means that if I may summarize, we have two solutions here. One was suggested that we have separate sections, one for single correct answer and other for best answer question. And second is because every question has its own lead-in statement. So those questions, if they are appearing in the same paper, that still can be used. Right. Can we move on to room 3 for their second question, please? No, sorry, we haven't finished with this yet. Sorry. A 2-year-old child presents for rectal bleeding, which is the most likely cause of above presentation. Yes, comments, please.
If I may, there should be, I'm not a pediatrician, but maybe there should be more detail in the scenario.
Hello.
Yes, I fully agree with that. The scenario is not providing any clue what could be the possible cause.
Hello.
So yes, scenario need to give the detail and some indicators what is going to be the most likely cause. So I think we need to give more information in the scenario. Yeah, and any other comments, please? Yes, please.
Yes. Hello.
Yes, I can hear you.
This is my question. I prepare it and I share it in the WhatsApp. I'm a pediatrician. So this question is need to be changed. How can I share it? The question, I'm not sure, but I prepare it like that.
Can that be presented here?
Yes, 4 years or 2 years, 4 years old presented with bleeding per rectum, small in amount, on and off for 1 month, with normal clinical examination and investigation. What is the most likely diagnosis?
No, if you say the normal investigations and there's nothing positive on physical examination,
yes,
then
with normal clinical examination and investigations.
Yeah, this means that there's nothing positive on physical examination,
Yes, yes.
and there
This,
is nothing positive on investigation. But is there
yes,
any history of constipation?
yes. With minimal amount of on and off, just
No,
for
no.
1 month,
I
and
mean, any history of
there
constipation?
is no there is no past medical history of the similar conditions.
No, in your scenario, you are giving the constipation as the most likely answer, but is there any
Yes,
information in the scenario to say that there is constipation?
yes, Aywa. There is an abdominal distension and abdominal pain.
No, but
So
then there are positive findings. Then you cannot say there are no positive findings.
no. There is no clinical examination. On examination, just there is there is no on examination there is an abdominal distension. There is no abdominal distension. So on the constipation, not an absolutely you confound on examination abdominal distension. No.
I mean that's what everybody is saying, that we need to uh, give some more information in the scenario. Yes, Dr. Mumtaz, please.
Yes, sir. I agree. Just a comment and a suggestion for that. How will student rule out the other causes? So we have to give some more data and just to rule out the other causes. You are very right. Maybe these are the most common thing, but to rule out MEBSs and other things that you have mentioned, you have to give some
So
more information. This is
okay,
my
ulcerative colitis, the age of the child is not correlated with the age. The age is not correlated with ulcerative colitis. So this is number one. And on the ulcerative colitis, there is another clinical manifestation should be found. The another thing is the amoebiasis, the dysentery. When we do an investigation, you can find the interamoeba histological. So the investigation which is normal, and the third thing is celiac disease, not Hirschsprung. I'm not put Hirschsprung is one of the. I'm not put the Hirschsprung is one of the options. I put celiac disease. Celiac
Right.
disease, yes.
Okay, right. Yes, Dr. Skinner, thank you very much for your explanation. So what we are actually concluding is that probably we need to give some more information in the scenario, which should indicate the towards the most likely answer. For example, if your constipation is the answer, then you may have to give some information in the scenario about that. Okay, thank you very much. Can we move on to next? This was room 3, is it? Dr. Skinner, you are from room 3.
No, I'm not. I'm from room 5. I share my question on WhatsApp group
Okay.
and on the chat. I'm not
we?
sure. I'm not
Yeah.
sure
Can
why
we?
they take this question here.
Can we go to room 3, please?
Assalamualaikum, sir.
Yes, room 3.
Yes, sir. I'm going to share my.
Yeah, your second question, please. Yeah.
Yes, sir.
Okay.
Hope it's visible to everybody here.
Yeah.
Sir, so
Okay.
this BAQ is from the anatomy and it's targeted for the MBBS year 1.
Right.
55-year-old postmenopausal woman reported to the emergency with a history of fall. She complains of severe pain in the forearm. So the lead-in is what is the most likely site of fracture? So A is monsoon fracture, B radius fracture, ulnar fracture, and ulnar radius fracture.
Okay. The comments, please. You think there is enough information in the scenario to find the most likely site of fracture? Is there enough information?
I don't think so that there is enough information. Uh, the history of fall, the fall should have been described. For example, falling on the outstretched hand and the same hand which was fractured, or you can give some swelling on the anatomical site of swelling. Then that would have been more appropriate scenario. Thank
Right,
you.
right.
Right, sir.
I think
I agree.
we should remember that the scenario is the one which would help the student to find the right answer. So we need to give right indicators in the scenario. And second, for example, in this question, the lead-in statement could be that which of the following sites, which of the following uh, are anatomical sites are bones is most likely the site of fracture, right?
Yes,
Okay,
sir.
right. Yes, Dr. Mantas?
Um, Thank you very much. Actually, I'm basically from orthopedics, so just a comment on this. Actually, this scenario, I agreed a little bit. You are mentioning about the osteoporotic fracture. So, for me, you mentioned the radius fracture an option, ulnar fracture an option, and D is ulnar and radial fracture. So, it can be a radius fracture, it can be a ulnar and radius fracture both. So student will be confused whether he has to mention only the radius fracture or he has to mention the radius and ulna both fracture, because ulna is comparatively less incidence. So I think you have to give more data if you have to in the stem mentioning about the swelling at his radial side of his wrist like this or distal part of this and outer side. You can I think you have to give more information if you want to choose a one last three if you want a student choose a one option from last three options, so you have to give say a little bit more information.
Right.
Thank
Okay.
you so much, sir, for your
Yeah.
feedback.
Yeah. Dr. Maizatul?
Sorry, Prof. I put up my hand. Sorry.
Oh, no, it's okay. It's okay.
Prof, maybe I take
Thank
the
you very much.
opportunity to say
Yes, sir.
something about that. I
Yes.
mean, knowing my, I mean, the students at the university. I mean, if I did not know anything about that. I'm not from orthopedic either, so I would choose, ulnar and radius coming both together in that option. So I will choose D, even though I don't know anything, because it seems that it's closer. I'm trying to encompass a bit of everything, so it's a
Right. Yeah.
bit easy.
So, Dr. Imtiaz, you are very exam savvy. Yeah, because the D is saying is different than the others in terms of uh, two bones. So that answer stands um, uh, differently from others, and somebody might think that that is probably the right answer. Right? Okay. Thank you very much. Can we move on to the room 2, please? Room 2 with their second question. And we have somebody from room 2, their second question.
Assalamu alaikum, sir. I just want to tell group 2 that Bushra is not here. She has some connectivity issue. So some
Oh,
other member of group 2 can share the screen, please, because she's not there.
all right. Okay. Is there anybody else from room 2 who can share? Or we can go to room 1. Can we go to room 1 for their second question, please?
Yes, I will share it in a minute. Please give me
Right.
1 minute.
Thank you. Okay,
This is our second question,
right.
and I'll just put it in on the slideshow. This is for MBBS fourth year, and the subject is chemical pathology, or you can say pathology, and the area is diabetes mellitus, pathogenesis of diabetes mellitus. A 48-year-old male was diagnosed to be having impaired fasting glucose about 4 years ago, but now his physician has informed him that he has developed type 2 diabetes mellitus. Which of the following pathological processes is most important in this patient, leading to worsening of his disease? So this question is basically related to the pathogenesis of type 2 diabetes mellitus, and the best answer is insulin secretory defect at beta cells. The background is that there are two mechanisms involved in pathogenesis. One is insulin resistance, and there is a discussion of whether which of the two is more important, and the general consensus is that it is the secretory defect. So this was the question. Open for discussion now.
Okay, comments, please. Any comments? I think the scenario is very good. It shows the progression over time. So that gives a clear idea to the student that they are dealing with a situation where the problem is worsening over time. That's good. Now, just want to ask, does it make difference that we have first and the last statement saying the defect, and the middle three is saying the resistance? Does it affect the question in any way?
Insulin, this glucokinase defect is once again a phenomena of resistance. So yes, we can change it.
Yeah, I mean, if we that would make it more sort of homogeneous. Yes, yeah. Any other comments, please?
Yes, Prof. I think the
Yes,
pathology,
Dr.
like,
Imtiaz. Yes.
yes, Prof. So looking at the pathophysiology of diabetes, it's both of resistance and secretory defect of insulin. But which one? I mean, to hinge on of course the secretory defect is based on studies, beta cell, all this, right? But resistance also, if you look at, there's nothing, I mean, telling us that the patient did not gain weight or things that worsen his insulin resistance over the time. So maybe this part of
Yes,
things maybe.
we can add that in the scenario. Yes, it's a good point.
Right. Okay, good. So we got some very good feedback on this question. Any other member want to say?
So there's an element of test wiseness in it, because even if the option A becomes resistance, adds resistance to it, then it's very easy to pick E as the odd one out.
Yeah, that's why I was initially we were discussing with Dr. Ahmed and whether we should have 4 statements or 5 statements, and adding an additional statement might have some difficulties. So I mean, we have been discussing that. So the point that the test-wise students, to deal with test-wise students is an important issue in multiple choice question.
May I share my experience in this question?
Right.
I use this is my innovation. I use MCQs in teaching also, and I am teaching for the last maybe 2 decades.
Right.
And whenever I put this question in my class, postgraduate class,
Right.
Only maybe 10% student give the right answer. Most of them, they roam about the resistance. They actually they get confused about which resistance is more important, adipose tissue, liver, or muscles, or the glucokinase defect. Very few use their test wiseness, but it's a good point.
Right. Okay. Thank you very much. Have we done all the rooms, or is there any room left? Is there any room which we have not covered?
In room 2, actually, Dr. Bushra was supposed to present,
Yeah,
but she is
unfortunately she's not there. Right.
not there.
Okay, now we are coming towards the end of this session. Is actually we are already 10 minutes over the time. Any final comments or questions by any of the worthy members? Do you want to give any feedback to us to how to improve these sessions in future?
That was
Yes,
an
yes,
excellent
Dr.
exercise.
Mumtaz. Yes, Dr. Mumtaz.
Thank you very much, sir. Actually, it's a very good session, very informative, and for people who have already attended few workshops of like MCQs making or this sort of thing, this is also for us to recall many things. And my feeling is this: whenever we attend such workshops again, and every time we get some few new points and few things that we have lost to remember. So for me, it was very informative, and thank you very much for you. This is my feedback.
Yeah, thank you very much, Dr. Mumtaz, for your kind words. Yes, Dr. Miza. Miza, your voice is breaking. Can't hear you anymore. Yes, Dr. Amir, please.
Thank you very much. I really enjoyed the last 3 hours and I learned a lot. There were many misconceptions which have been cleared. And actually, medical education is my passion and I always enjoy. But Professor Alamsher and Dr. Rukhsana, you have done wonderful job. And my request is to continue it. We have already made a group. So why not to go to the second workshop about the psychometry, about the quality of a good exam, and
Yeah,
then to the
actually,
skill.
Dr. Amir, we have these regular activities. We conduct these webinars and the workshops alternate. Every month we have one activity, and our next webinar is inshallah going to be on integrated OSCE, which would be in February, inshallah. We will announce the dates and the times, etc. Right. Thank you very much for your comment. The one thing I want to say is that during the feedback on the questions, maybe sometimes we have used so-called some harsh words. If somebody has felt like that, please forgive us for that, because purpose is not to hurt anybody, but to just give the opinion, the right opinion about that. All of us are trying to improve our efforts in assessment of students. Yes, Dr. Imtiaz, please.
Thank you, Prof, for this monthly lecture. It allows us also to get to improve our skills. But I found something while doing this practice, this constructing this. I found that it's a bit. We need to be really very expert in that field. So is it maybe I feel that maybe the student being, I mean, not an expert in orthopedic, not an expert in that, and he has to answer this question, and I think it requires a lot of um, uh, knowledge about the subject to that point that you can even differentiate between the two. I think it's much more. Uh, I mean, if I do something like if I have to construct a question like the orthopedic question, would have been like for me a bit much more difficult to construct that in another field.
Yeah, absolutely right. Actually, that's what we do in our vetting, Dr. Imtiaz, because in vetting session, only the presenter is the specialist, but all other are from different disciplines. So every member on the vetting team, they see the question differently. And so that's how the questions are brought to the level of the students from the level of the specialist. So vetting plays a very, very important role there. Thank you very much for your comments. Yes, Dr. Sakina.
Thank you very much. I'm so happy to join this workshop. Thank you very much, Prof. Alam. It is a very comprehensive, very excellent workshop. In the future, I will join for all workshops on webinar بإذن تعالى إن شاء الله. Thank you very much.
Thank you. Yes, Dr. Bushra, please.
An excellent exercise, sir. I've been attending your webinars for quite some time. I think we started it somewhere around 3 years or maybe more.
Yeah,
but
that's
this
right.
was
So we started in 2020. Yes.
Yeah, around the time of COVID.
Right.
My take-home message from today's excellent workshop was, rather when I'm making a question, I try to adjust the options, because now I understand that my scenario needs to be more context rich.
Right. Yeah.
And when your
absolutely.
scenario is more context rich, you have little trouble in adjusting the options.
Yeah, that's right. Yeah, thank you very much, everybody, for your kind comments and your support, and for joining this workshop. We would be sharing the video recording of this workshop in the group once we have edited that. And in the meantime, if anybody has any comment or question, please do share in the group, and maybe your question can be answered by the fellow members. With that, I thank you for your support, and we really enjoyed this session, and hopefully we learned something which would help us to improve our assessment in future. Thank you very much. Yes, Dr. Ruxana, want to say something?
I just want to say thank you to everyone for listening, and hope to see you soon, inshallah. Thank you.
Thank you.
Inshallah.
Bye-bye.
Thank you. Bye-bye.
Thank you all.